starting to get people signing on and audio connecting. Welcome those that are here signing in. We want to welcome you to the event. We're just going to spend about a minute or so admitting people into the event so they can kind of get settled and before we officially start. So we're glad to see you all here. Very excited that this is finally coming to fruition.
Now I might, you might get muted when I mute everybody.
Okay.
So if you need to speak, then just make sure you unmute yourself to the panelists and everybody.
Okay. Yeah, so it's about 7:01 right now. We've still got people jumping on. So we'll just give us a little time here to get everybody rolling in before we get going here. All our panelists are here. We've done all of our checks. Let's see, I've got 7:02. I know some people are still rolling in. You want to, Bert, you want to go ahead and start while you're in? I can do some admitting while you're speaking at the beginning here.
Yeah. All right. Good evening, all. It gives me great pleasure to be with you all here tonight. My name is Bert Miller. I am the president of the Broward County Council PTSA. I have been an active volunteer in Broward for over 17 years. I am fortunate now to have the ability to assist our area even more in my position on the council. The health, both physically and even more so mentally, of our community is very important to me. That is why when I became president of the county council, one of my first goals was to create a mental health committee. I am grateful to Nora Rupert, who has taken the role as chair, and to all her hard working committee members who have made this even possible tonight. I want to thank this evening's panel, Saborni Barnes, Keith Bostick, Shantae Cummings, Sandra Kumpner, Blake Cohen, Nora Rupert, and our moderator for this evening will be Joel Smith. Thank you all for your willingness to give up your evening to be here with us, all of us tonight. I would also like to thank United Way for all of their support and assistance in making this event a success. I will now turn it over to Nora Rupert, our chair for this event.
Good evening, all. I am so honored to be here with our panelists and the participants for this evening's town hall, Empowered Mind, Empowered Life. My name is Nora Rupert, as Bert mentioned, and I am the chair of the Broward County Council PTSA Mental Health Committee. I'm proud to have worked diligently alongside my committee to organize this event for our community. A special thank you to Bert Miller, the Broward County Council PTA's president, Nora Rupert, the Broward County Public School District 7 school board member, and Joel Smith, our moderator this evening from the Florida Initiative for Suicide Prevention, for their role in tonight's event. For without them, we would all not be here tonight. This evening, we encourage an open discussion about mental health and about wellness. We want you as a community to know that it is okay to not be okay, and that there are people and resources available to you. Our hope is by holding these type of events with an open discussion, we will in part help lift the stigma surrounding this topic. The first 30 minutes of this event will be a resource and information fair. You may want to have a pen and paper handy or possibly take a picture with your phone of any contact details you might want to follow up on. Immediately preceding that, our moderator for this evening, Joel Smith, will begin the Q&A portion of the event with our panelists, who will also be assisted by Allie Walford with the questioning. Once the Q&A portion is completed, we will then raffle off 7 prizes from those of you living in Broward County, and also those of you living in Broward County who have signed up to receive the resource bags. We will be delivering those over the next 5 days. There will be a list of providers of those who are part of the resource and information fair at the end of the event, so we can get an idea of who is part of that. I want to give a special thanks out to, again, my mental health committee from the Broward PTSA, the United Way for their extraordinary assistance in every aspect of this, Joe Dimaggio Children's Hospital, and Quota of South Florida. We will now begin the resource information portion of the event.
More than 70,000 people die from drug abuse in a year. 7.5 million people work more than one job to make ends meet. Human trafficking is a $32 billion industry in the U.S. On a single night, over 500,000 people are homeless in the U.S. Together, with thousands of corporate partners and millions of donors and volunteers, United Way fights for the health, education, and financial stability of every person in every community. Together, in a year, we help more than 3 million people get health care services and support, and over 1 million people get on the path to financial stability. We help more than 2 million at-risk teens with out-of-school programs and individualized support, and over 500,000 people get back on their feet with job skills training. These are the faces of change. You can be one too. More than 70,000 people die.
More than 70,000 people die from drug abuse. 7.5 million people need to work more than one job to make ends.
We're just on pause here while Bert's just trying to load up the portion of the more of the videos that we receive from our providers.
We all have one thing in common right now. We're all adapting to a new normal. Whether you're experiencing stress, loneliness, or anxiety, remember, we're all in this together. It's okay to not be okay. To get help, dial 211. Brought to you by these partners.
Hello, we're here to tell you about an important resource called 211 Broward. It's a number to call when you don't know the number to call. Our counselors are highly trained, multilingual, empathic, and empowering. You know, we're here 24/7 when we're free and confidential for any parent or caregiver or youth that needs support and resources. So just remember that number, dial 211. We're also here to provide suicide and crisis intervention for our community. You can also chat and text with us. Please dial 211.
Our mission at the Advocacy Network on Disabilities is to champion the rights of individuals with intellectual, developmental, and other disabilities by promoting inclusion, providing services, and advancing systems change. We are here to help you and your families. We serve families through weekly in-home counseling and a parenting education program. We also assist in providing concrete needs such as family stabilization funds, assistance with transportation, and wheelchair repairs. We provide services in English, Spanish, and Creole. If you're interested in finding out more about our services, please contact us at 305-596-1160. Thank you.
We are who we are. That's the beauty of us all. We are potential. We are the future. And we need each other. Because here, there is no you or me. There is only we. Big brothers, big sisters. We are proud of who we are.
Quota of South Florida, Broward County.
Boys Town mission is to change the way America cares for children and families.
Boys Town believes that every child deserves a future, every family deserves to stay together, and every community deserves to thrive.
And we are here to help you and your families. We provide in-home family services, care coordination services, and parenting classes.
We speak Spanish, hablamos español.
And Creole, para Creole, please call us
at 754-222-8451 or 954-498-5526.
We teach love.
We all have one thing in common right now. We're all adapting to a new normal. Whether you're experiencing stress, loneliness, or anxiety, remember, we're all in this together. It's okay to not be okay. To get help, dial 211. Brought to you by these partners.
I'm Marietta Levinson, Director of Community Relations for Critical Health. For 25 years, we've provided exceptional behavioral health services, including therapy, case management, and medication management. Through the years, our highly trained and skilled providers have delivered services in schools, homes, and other appropriate settings to adults and children as young as 3 years old. In March, we transitioned to telehealth services to continue providing support during these trying times. We are dedicated to contributing to the wellness of our communities, not only today, but in the coming year.
Family Network on Disabilities is a statewide, peer-driven, nonprofit organization helping families with loved ones from birth to age 26 with any disability. We provide information, resources, training, and support at no charge for families and to those who serve this population. Check out our website, fndusa.org, for more information and resources, or give us a call at 800-825-5736. That's 800-825-5736 to see how we can help you and your family.
Community Youth Services is a leading provider of innovative, high-quality, family-centered services utilizing evidence-based practices with the goal of improving the lives of those we proudly serve. Since 1999, young people in Broward County who are struggling with healthcare, family, and social problems have turned to CYS for help. An initiative memorial healthcare system, CYS offers a wide variety of resources to Broward's youth and their families, including after-school activities, crime prevention programs, early intervention, and substance abuse services, healthcare, and more. Community Youth Services has already touched the lives of thousands of young people by providing opportunities for youths to succeed. We benefit them, their families, and our entire South Florida community. You could be the next person whose lives we help change.
Hi, the mission of Jack and Jill Children's Center is to break the cycle of poverty for children of high need working families through quality early childhood education and family strengthening programs. We are here to help you and your families. In addition to early education and family strengthening programs, we offer elementary education, health and wellness programming, including clothing pantry, and emergency assistance for our families. También hablamos español. Please do not hesitate to contact us at 954-463-8772. Thank you.
NAMI, the National Alliance on Mental Illness, is the nation's largest grassroots organization dedicated to improving the lives of individuals and families affected by mental illness. NAMI Broward County provides referrals to services, education programs, and advocacy for the improvement of mental health treatment. To join us, visit www.namibroward.org or call 954-316-9907.
One Community Partnership 3 is a system of care grant that aims to support Broward County's two largest child-serving systems, Broward County Public Schools System and SEDNET Child Welfare System. OCP3 links youth ages 12 to 21 with evidence-based community resources. And we invite you to unmask your feelings about the emotional ups and downs associated with living through this pandemic. Visit ocp3.org for more information on eligibility criteria.
Hello, this is Carlos Camacho, Community Outreach Supervisor for Psych Solutions. We provide mental health services for students and their families in Dade and Broward. These services are provided in home, at schools, or even via telehealth. For more information, please visit us at psychsolutionsinc.net or give us a call at 305-668-9000. Thank you so much for this opportunity and looking forward to hearing from you.
Hello, my name is Shantae Cummings and I'm the project manager for SEDNET Region 10. SEDNET is the multi-agency network for students with emotional and behavioral disabilities. SEDNET works with the local school district, local community agencies, and also community-based providers to provide a quality system of care for students and families. SEDNET has a partnership with 23 agencies to provide services to students and families at no out-of-pocket cost. For more information, please visit sednetfl.info. That's sednetfl.info. Thank you.
Good day, beautiful people. Bev here. Let's take a moment to breathe together, shall we? Close your eyes and take a deep breath in through your nose and out through your mouth. Welcome back. So happy to be here and connected with you all. I'm Beth Perez, founder of Shield Us. We support the law enforcement community in identifying and healing from mental, physical, and emotional challenges that come along with this career field. I invite you all to go to our website at www.shieldus.app to download this free resource to stay connected with us.
As we're returning to school, some of you may have heard the term twindemic in social media, which is a concurrence of the flu season along with COVID-19. And because of that, it's particularly important this year for people to get vaccinated for flu. We don't yet have a vaccine for COVID-19. So the best thing you can do is to get vaccinated for the flu. The flu vaccine is a safe vaccine. If you have a particular concern about getting the flu vaccine, you should consult your pediatrician.
Smith Community Mental Health is committed to delivering mental health and substance use services that are designed by the needs of our Broward County individuals and families. Smith has a full continuum of behavioral health programs to meet the needs of families with a variety of challenges that include mental health, substance use and diversion in-home therapies, comprehensive treatment, case management, as well as specialty after-school and year-round support services. Please visit our website at smithcmh.com or call 954-321-2296.
SunServe is a nonprofit organization in Fort Lauderdale that provides services to the LGBT community. In the youth department, we provide therapy, life coaching, and peer-led social support groups for youth in middle school, high school, as well as early college. For more information about what SunServe does, please check out our website, www.sunserve.org.
Tobacco epidemic among youth. As a result, thousands will face a premature death, as well as countless health issues in the future. The United Way's Broward Youth Coalition wants to let you know about Tobacco 21, a national campaign aimed at raising the minimum legal age to tobacco and nicotine sales in the U.S. to 21. If the legal age is raised to 21 nationwide, there would be 250,000 fewer premature deaths and 50,000 fewer lung cancer deaths per year. It is our moral obligation to act on this matter now. Consider the benefits of raising the legal age to buy tobacco in your city today. Thank you.
Okay, I just got to switch videos here. Let's see.
I had to leave.
Okay. Where is it? I don't know what's going on here. Give me a minute here. I got 3 screens and it's coming up on the wrong screen. Let's see.
I had to leave my parents.
Tell me if you can see it when it comes up here. Can you see the video?
Yeah, I can see it.
Okay.
I had to leave my parents. I had to move schools. I don't know anyone here.
We're not seeing this. We're seeing your screen, Bert, not the video.
Okay, hang on a second then. I don't know why it's not playing, why it's not showing that screen. All right, let me try another.
I had to leave my parents. I had to move schools.
I can't see it.
Hang on a minute.
Everything keeps changing. Why is this happening to me?
Can you see it now or no?
I'm
I
sure
can see your screen, but not the video.
What screen are you seeing?
We're seeing the list. Your spreadsheet. Like you.
I don't know why this isn't playing. I can't pull that screen up.
Just want to do that one that's the end, that's fine.
I had to leave my parents.
I don't know why it's not coming up.
Or we just try that other one, the end of the other one then, because that's okay.
Hang on a second. There it is. I think I got it now. You see the girl?
Yeah, I see it.
I had to move schools. I don't know anyone here. Everything keeps changing. Why is this happening to me? I'm sure glad you're here.
Change a child's story. There's a child in foster care waiting for a volunteer like you.
I'm Rick Riccardi. I'm the CEO of Fellowship RCO.
Hi, I'm Sarah Barkley. I'm the COO of Fellowship RCO. Our mission at Fellowship RCO is to support those seeking to initiate and sustain their recovery from a substance use disorder, regardless of their chosen pathway.
Fellowship RCO is a non-for-profit 501c3 organization. We provide peer-based recovery support services, structured housing, outreach, community education, recovery-focused activities, and prevention programs.
At PACE Center for Girls Broward, we provide girls and young women an opportunity for a better future through education, counseling, training, and advocacy. We offer a full-day academic and counseling program with a 1:14 teacher-student ratio and a counselor assigned to each girl who enrolls. We also offer a REACH program that provides individual and family therapy, as well as a diversion program. We also speak Spanish. Please do not hesitate to contact us at 954-561-693.
Hello, my name is Selena King. I'm a System of Care Manager at Broward Behavioral Health Coalition, Broward's managing entity, and also a member of Broward's Community Response Team. Today, we'd like to give you an introduction to what is a recovery-oriented system of care, or ROSC for short. ROSC is not a model, but a value-driven framework to promote health and wellness for adults, children, and families throughout their chosen pathway to recovery. Using a recovery-oriented focus allows us to move away from an acute care response or crisis mode to how we can help ourselves and those we care for with overall wellness. ROSC is not one entity or person or agency, but how, as community partners, we can be inclusive of peer relationships, family, and natural supports. ROSC is about focusing on an individual's strengths and preferences, partnerships, and creating a meaningful lifestyle. A simple beginning to ROSC is language matters. How we communicate is a major focus to ROSC. We are sharing a one-page flyer with strengths-based language that you can begin to use starting now. Using strength-based language is powerful when communicating with individuals, family members, your staff, and other community partners about someone who's living with mental health, substance use, or often co-occurring symptoms. If you would like some more information about ROSC, please feel free to contact me and I will be happy to help. Thank you.
Okay, I've got one more here and then that's it. Let's see.
It's hard to hope, hard to cope with crisis. But while we might be all alone, we've never been more tightly tethered, because we'll only weather this unknown together. So we get to work. We mend, we don't break even when we bend. Somewhere, another mom pays her bills. Somewhere, another child eats his fill. We were the world's neighbors, making our communities brighter, greater, fighting for every person in the neighborhood. We, the coming of the common good, so dare to care, to be hope-sighted. We're never divided, for when we live to give, we always live united.
Okay, that ends our resource fair. Now I'd like to turn it over to Joel Smith, our moderator,
Introducing the iPhone
for our
12
Q&A.
5G, now at T-Mobile. Unleash.
Well, good evening, everybody. Thank you so much for joining us tonight. We honored that you have taken the time out of your evening to do that, and we're excited to try and address the questions you have. This is a new way of doing business in our new world, so Bert, thank you for your patience to try and make that happen, and thanks to everyone for their patience as we move forward. My name is Joel Smith. I am the program director for the Florida Initiative for Suicide Prevention. We work through the entire arc of prevention, intervention, and postvention in the desire to help people find health. And I'm going to moderate tonight. I want to show you my No Stigma t-shirt, so you'll see what the kind of work that we're trying to do here is to make sure that we're addressing the fact that we're all in this together. There's no finger pointing or shaming. I'm going to first introduce you and do a brief bio to the panel, and then we're going to drill right into your questions. I first want to introduce you to my friend Sigourney Barnes. I want to let you know that she was so excited to be here. She tried to log in at 6:30 this morning. And fortunately I was up, so she didn't wake me up. But yes, she was anticipating this event. But Sigourney is a native Floridian and is passionate about, as you can obviously tell, about doing this work. She's worked with the SunServe organization for many, many years, supporting our LGBTQ community. And she is a graduate of Florida Atlantic University, where she received her Bachelor's of Social Work. And we are happy to have her. And before I go on, I just want to remind everybody that we intend to give you everyone's contact information via a follow-up email once the event is over. So you don't have to take notes, but we will make sure that we can get this resources to you. Secondly, I'd like to introduce you to my friend Keith Bostick, still at work, I believe. Keith is the Deputy Director for Broward County Human Services, and he oversees a staff of about 700 people. And everyone grab your chair, about $166 million worth of services directly addressing the needs of Broward County residents. He didn't ask me to tell you this, but he has two lovely daughters. One of them just accepted a graduate school placement in Colorado, and one of them is a student athlete in North Carolina, I believe it is. So we're happy to have Keith with us tonight. Next on our list is Blake Cohen. Blake is a certified addictions professional and the best-selling author of this book. As you can see, I have my copy. If you are interested in the arc of recovery, Blake is an absolute expert and master at it. And he now, with a partner, facilitates his own business. He's the co-founder of Next Level Recovery Associates, so that he can bring the services directly to people who need it. Next, my friend Shantea Cummings, over there in the black flowered dress. Shantea is the SEDNET coordinator for Broward County Schools in our community. You saw her in that little clip that we played for everybody. And she, for 16 years, was a school psychologist and has moved over to coordinate services across the arc of the systems to make sure that your kids, our kids, are getting the services that they need. Next, we're going to go to Sandra Kumper. Sandra is should I tell them how many years you've been a professional, or should I keep that between us? Let's just say that Sandra is a longtime professional in the mental health industry, serving people's needs, and as the CEO of NAMI, you probably know her well as the person responsible for that beautiful walk they do every year to bring awareness to mental health in our community. And last but not least, your friend and my friend and a very important person in our community, Ms. Nora Rupert, who is our District 7 school board member and is a past chair of the school board. And I hope you know that Nora was a former reading teacher and is passionate about the needs of children. You may not know that, and I'm going to tell you some secrets now about Nora, that after college, she worked on cruise ships as a singer. And she's a passionate lover of dogs, particularly Weimaraners, and she's on her third, who I think is the boss. Her husband is Eric, and I think the dog comes first, and then we'll see what else happens. But yes, and that if she ever gets any spare time, she does get an opportunity. They have a little getaway up in Canada, and if you ever are alone with Nora, get her to tell you her crossing the border story, because it's an absolute winner. That is our panel. We want to thank them very much for participating. They're doing this on their own time because they're passionate about what they bring to our community and to you. So we're going to start the questioning. I'm going to bring it right to Nora because I think it's a critical area for our community. COVID has impacted the way we educate our children and the way we serve our teachers so that they can educate our children. And I know that it's a moving landscape, and I want to ask you, what should we know right now about what's happening?
Hi, thank you for the opportunity, and thank you all who have tuned in, and for my fellow panelists. Right now, we are keeping an eye on the COVID numbers for the county, and our superintendent, Mr. Runcie, is in talks with the state of health officials and Tallahassee as to see what's coming down the pike, what can be done. The big focus for us was being able to make our schools safe for the students that wanted to return. And as of the beginning of this year, and I believe last week, we had about 20% of our student body return to brick and mortar buildings, and the other 80% are either homeschooling or doing e-learning. So those are our parental requests, and we wanted to make sure that our parents and our students and families could have the education that they felt was right for their student during this time. So we were very happy to hear in the last 24 hours that the option of doing a hybrid version, which is your e-learning as well as our face-to-face learning, would be, we're going to have another executive order from the governor that will extend us to the end of the school year. It was to expire the end of December, so now we have, he's getting together to do his executive order, and I can just say, let's keep our fingers crossed, and we have to advocate to make sure that the money comes with the executive order so we can continue.
Thank you, Nora. And again, we'll give our panelists a chance to add on if they choose to. And if there are follow-up questions from our audience, please put them in the chat, and we'll do our best to reach out to them. Keith, I'd like to ask you a question came in about from the community. Are there any programs available to assist or fund housing if people are in distress?
Yeah, good afternoon, good evening, all, and thanks for having me. I'm excited to be a part of this and be a part of this effort for the entire community. Yeah, Joel, here in Broward County, similar to other counties, we are experiencing a significant issue related to homelessness. We've been very fortunate to receive a number of federal grant and a number of federal fundings to look at how we can support those who are homeless or on the verge of being homeless or need to be housed in some way. And so those services can be accessed through a couple of different ways. One is our community partnership division. And at the end, as Joel indicated, we will give all of the numbers on how to access that and the information. You saw some of the resources come up, but we are looking at how we house our most vulnerable individuals. We currently have, in fact, a portal just opened today that will be open for at least 2 weeks, where we have some of the CARES Act funding to provide rental assistance to Broward citizens who have been impacted by COVID. These individuals can apply to receive up to 75% of their rent for the first couple of months, and then another 60% of their rent assisted from April through December. And so I would encourage all of you who might have individuals who are either experiencing homelessness or at the risk of homelessness and who've been impacted or had a COVID-related loss to go to broward.org to the website, and you can look at how you can access some of those CARES Act funding. But Joel, just to answer your question, we have about 6 different buckets of resources to help support families. The challenge I will say is that Broward County still has a significant issue around affordable housing. No matter the amount of money, we still will have a deficit related to adequate and appropriate housing for citizens.
Thank you, Keith. Could I just follow up? Can you share with the population what the Family Success Centers are and how they access that resource?
Sure. Family Success Centers are our centers that are focused on looking at helping families become and retain self-sufficiency. We have 4 centers throughout the Broward County, strategically placed north, south, east, and west. These are centers where individuals who are experiencing challenges with housing, individuals who are experiencing challenges with their utilities, individuals who are experiencing challenges with getting reconnected to the workforce and going through some significant training. The Family Success Center we categorize as our glue. It fills in a number of different holes where families and systems are break down and have significant gaps. That information will also be provided to you so that you can access them. Our services have never stopped operating, even in the midst of the pandemic. We have restructured how our service delivery takes place, where we are socially distancing appropriately. A lot of our services can be accessed online. And even for those who still want to come up and have the face-to-face interaction, we've structured a very safe system of some drive-bys that will support people getting their assistance quickly.
Thank you, Keith. I suspect a number of people will want to jump in on this one, but Sandra, the question came in, how to deal with stress during this pandemic when we're so socially isolated?
Hi, you all. Thank you so much for having me, and hi, Joel. You know, when this pandemic occurred back in March, we had an influx of calls from the community, particularly college-age students and high school children. And I realized at that time that the stress, the anxiety, which led into a lot of depression, was becoming dire to this community and the world. So we started at NAMI Broward, we started a program that dealt directly with young people, inviting them to just call in, be a part of the system, to distract them from the main focus of the pandemic. And we felt that that kind of support was exactly what they needed. They needed some kind of distraction. And while we would talk about situations pertaining to the pandemic, we would also try to get their minds working elsewhere, to get involved in other things, get their minds wrapped around other activities. And one of the greatest concern we realized they had was not being able to complete school in the classrooms. So we worked on just providing support for them. And on a whole, stress can lead to a lot of other issues, mainly depression. And we want to educate our young people on what stress looks like, how to work on issues when they realize that they're experiencing symptoms, and just to be able to recognize the symptoms associated with this. And we talked about other ways of overcoming stress, reading, exercising, getting sleep, which was a lot of the problems that they were facing, making sure that the nutrition is okay, and talking about it. Most importantly, we wanted people to be able to talk about what they are experiencing.
Thank you, Sandra. Just to share with our population, in our community, funding has been made available through Broward Behavioral Health Coalition to provide absolutely free trauma support groups all over the community. There are a number of agencies that are providing them, mine, the Florida Initiative for Suicide Prevention. So we will put that contact area information into the response that we give to you all. These are free groups. They're not the kind of groups where you start on day one and you last 10 sessions. They are drop-in kinds of groups. You stay as long as you need to stay. They're all being done virtually at this point so that they're easy to access. And just another addition to what Sandra was saying about how, as a community, we're trying to support people's needs. I'd like to leave that to Shantae in terms of what is the district doing to ensure that kids who are on remote learning have an opportunity to find resources, social help, that sort of thing, and how does a parent reach out to facilitate that?
Thank you for having me, Joel. I want to say that Broward County Schools is in a unique position where we have literally hundreds of mental health professionals that work directly for the district. And one of the things that we are prioritizing, particularly with SEDNET and the groups that we work with, is having these mental health professionals work closely with their school teams. So if we have teachers who might be saying to the school counselor at the school, I'm noticing some signs in the student, or a parent has called me and they're asking for help, that school counselor can reach out to their school social worker, can reach out to their school psychologist. We have family therapists in the district, so there's always a connection there about how we can get services to parents. In addition to that, as I mentioned in my little clip about us having 23 behavioral health partners. So for those students who are needing some longer term assistance, and really for families, we connect them in the school district directly with these agencies through referrals to be able to really be able to provide a number of services that not only what the student needs, what the family needs, because I really feel like the needs of the student are just a small reflection of what the needs of the entire family is. So to be able to connect those things, we're really prioritizing that.
Thank you. I'd like to also, again, build on that to remind everybody that we're here and the bulk of our conversation is about kids, but all the people on the screen and on the panel are very committed to a system of care approach to dealing with these issues. We know that kids' issues don't exist in a vacuum. They're not all by themselves. They're family issues as well. So while we're here to talk about kids tonight, we have a sort of a case management approach to find services so that the family functions better. And we keep asking Keith to write checks about that so he can help us out. Sigourney, a little bit earlier, Keith was talking about homelessness in our community and affordable housing. And you, as really an expert and a spokesperson for seriously under addressed community, the LGBT community, can you educate us a little bit?
Not a problem. Thank you for having me today. And to answer your question, right now at this time, housing is very difficult. We all know this with COVID. One of the main reasons, of course, is because of the fact that face-to-face is difficult. And with getting housing for youth alone, that's already a struggle. If they're over the age of 18, there are difficulties, but there are agencies out there that can help. There's housing through Henderson, through the Flight Center, through Lutheran Family Services, but they all have certain criteria that you have to get through, and therein lies the difficulty. But we work with what we can and we try to help them as much as possible. And like it was mentioned earlier, helping with rent services, with mortgage payments. We do have some funds to be able to do that, but we can't do everything. So it's
I'm going to come back. I'm sorry, go ahead.
I'm just saying it's hard right now. And I feel for the youth as well as the families, especially those who they're losing their jobs right now. Of course, someone brought up, I think in the questions, what about the folks who work for the schools who they're leaving their kids at home? I have someone who they work for the school. Sadly, they got hurt and now they're no longer working. What about them and being able to keep up with housing? Every time I think of housing, I think of that family right now.
I'm going to come back to you in a little bit because there's a question that kind of is an intersection of you and Blake that I think together we can kind of put our arms around it a little bit. But Blake, question came in about medical marijuana and the fact that marijuana is starting to be more legal and more available. What does that tell our kids? What's the impact on the availability, and what are you seeing in that world?
Oh boy. Well, that's a tough question. And I do believe that medical marijuana has its place in certain areas. Unfortunately, having access to medical marijuana in the way that we do in this state it's still too easy. And it's also sending messages to our adolescents that it's okay to use. And the reasons that somebody has to be on medical marijuana to treat a certain illness, those illnesses are usually pretty severe, but that's not really what's marketed. Usually what we hear is if you're having trouble sleeping, if you're anxious, if you're stressed, if you're depressed, try marijuana. And that is not necessarily the right approach for adolescents. It's certainly not the right approach, and it should not be something that they're doing just because of the way it'll affect their brain chemistry. But it sends the wrong message, as you said, to these kids that if I have a problem, if I'm feeling stressed, if I'm feeling anxious, depressed, I should take an outside substance and put it in my body and alter my state of mind in order to cope with it. And that's the message that's getting out there. And it's not just the fact that medical marijuana is available, it's society in general is becoming more accepting of marijuana without providing the proper education on who needs it, on what it can do, and what it could potentially do if you have some type of underlying mental health disorder.
Thank you, Blake. I grew up at a time, and I think it still exists, when we considered, or we were educated to consider marijuana as the gateway to the demon world. Do you consider marijuana to be the gateway drug?
No, not anymore. I consider trauma to be the true gateway to any type of substance use disorder. I consider vaping to be the true gateway substance that we're dealing with these days. That is the true gateway drug. And although today's marijuana is probably equally as dangerous as some of the harder drugs due to the potency, I couldn't call it a gateway drug because I think any drug leads to another. But really, the reality is we've learned so much about substance use disorders, and we know now that they don't stem from somebody starting to use substances and liking them too much and keeping using them. Where they stem from is issues at home, from trauma, depression, self-medication. And during this time of dealing with COVID, add boredom to that mix, by the way, but dealing with COVID, people are more stressed, more anxious, more depressed than they've ever been. And they're turning to substances that they're being told are safe, that they're being told are natural, to try to cope with the issues that they have. And it is creating more problems down the road. So yes, it may feel good now to smoke a little bit and relax, but eventually it's training your brain, especially at an early age, that if you have a feeling, you take a substance, have a feeling, take a substance. And that's where it becomes an addiction.
Thank you, Blake. I want to remind everybody as we continue on that at the end of our event tonight, there will be raffles. We're going to give away all of Bert's money. So everyone stay tuned. A lot of heads nodded from the panel when we mentioned trauma. So I certainly would like to give the panelists an opportunity if they have a comment about trauma. Anyone want to go first? Anybody want to make a comment? Shantae, you were bobbing your head.
I was just going to say, I almost jumped out of my seat when Blake said that, because the idea of taking something to make me feel better, but we really have to get to the root of it. What is this thing that I'm feeling? What is this stress? What's the source of my stress? And what happens is when we consistently experience trauma, we're changing the way our brain uses and receives information, which then trickles down to everything else that we do. It changes our behavior, it changes our emotions, it changes the way we relate to people. And then with constant exposure to trauma, we find ourselves, or those of us who are experiencing trauma find themselves where they are constantly on high alert. And so that could obviously lead to the substance abuse, because now we're needing something to alter our system because it's not happening naturally.
Joel, this is Ali. We had a follow-up question that maybe the panelists can weave into this on how do we get our mind off of the pandemic right now? Because the pandemic is a trauma, and we had mentioned, you know, ways to get that off. Can you guys just give us a couple more examples of tangible things that the viewers could do to kind of give their brain a break for just a few minutes?
I can jump in really quick, because I also wanted to make another quick point that when the people who are here hear the word trauma, I don't want you to only think of the basics of trauma, of sexual, physical, verbal abuse. Trauma is a very broad term that can be something like the pandemic. It can also mean not feeling enough love. It can not having enough attention. All of those are considered trauma. So when you guys hear the word trauma, I want you to think broader than just the ones that we've always heard over the years, because that really has broadened. But as far as removing distracting ourselves from this pandemic, you know, that is definitely a personal choice, and it's all about us finding where we feel comfortable and what we feel comfortable doing. And for some people that's meditation, for some people that's walking, for some people that's finding new hobbies at home, for some people that's a Zoom, we're going to call it happy hour. It doesn't mean drinking, but a Zoom happy hour with your friends, finding ways to connect with people. Also learning to become comfortable with yourself and in peace. And you know, there are so many, you guys listed so many different resources that we can use to distract ourselves or to cope with this pandemic. And there's a ton more websites out there, national websites like betterhelp.com. There's a ton of websites that exist where we can go and you can find resources to help yourself.
Thank you, Blake. Sigourney.
Joe.
Go ahead, Keith. Go ahead.
Yeah, no, I just would like to just share that when we talk about trauma, we have to also talk about, you know, what that looks like from a cultural standpoint, from a community standpoint. How we respond to trauma is oftentimes how what we believe, what our experiences have been, and what the responses to those experiences have been. Many people on this call who are reaching that wisdom age probably experienced trauma in their early stages that they had no recollection of. I mean, that what's called trauma now was just called life. And now children and families are, you know, have more exposure, have more education. And so I think that families have to have an intentional conversation with their family about what people are experiencing and what they're feeling and what that means to them, you know, because we have different levels of coping, different levels of how we manage and how we handle trauma. And once again, some of that is through, you have to approach it through some cultural and environmental lens. And so I just wanted to kind of raise that. It says that everybody's not at the same starting place in their ability to manage and to work through trauma and to be resilient through it. And then my only suggestion related to how do we address, you know, moving away from getting some exhale from the pandemic, I think it's just going to be recognizing that what you're capable of doing, what's in your control, and helping children understand what is in their control. When they read and they see the numbers every day going up, You know, sometimes there's this whole feeling of being helpless about what can I do to impact the numbers? Well, what can they do to control them, to control what's happening to them? Whether that is, am I washing my hands enough? Am I covering my face? What does that look like in our house? To give some sense of accomplishment, because the pandemic can make you feel this is so overwhelming if you chew off the big pieces of it.
Thank you. And quick question. I'll get right to you, Sandra, but
okay.
I need to know, when you the age of wisdom, if I'm past that, am I going the other way? Before we get to sense, go ahead.
No, I was just gonna say, you know, those of us who have had some significant long-term life experiences, how about that?
Okay. Before we get jump right back to Sandra, I think it's not everyone may know that our community, Broward County, has over the last 3+ years made a significant commitment to racial equity work. And Keith alluded to part of that being the cultural differences that how stress is carried, perceived, and dealt with. And if you're interested in that, it's a partnership between Broward County and the Children's Services Council, and the school board is involved. So more information can be available, because COVID and trauma doesn't know color, race, sexual identity, or anything else. It's equal opportunity pain. Sandra, you were going to say something.
I just wanted to add a little bit to what Keith just said, and you know, I'm in total agreement with everything. And I noticed somebody wrote ACEs down there in the chat box, because we talk about the trauma that children have experienced, those adverse childhood experiences that is being manifested today. And with the approach of the manifestation of this COVID and all the issues, the psychological factors that comes with it, then we see a lot of individuals reacting to this. And also I wanted to talk about just being true to ourselves, because we are all fearful. We are all unsure. We are all, with a lot of us, those of you who are younger may not have experienced anything that vaguely resembles what we're going through today. So we need to be true to ourselves. We need to acknowledge that this is a scary time. We need to be true to our children and to explain to them that we don't have all the answers. But we also need to explain that, you know, this kind of thing, these pandemics have happened in the past, and people have survived it, and people have moved forward. And so we need to continuously encourage our young ones about the positive. You know, there is a tomorrow, and we're looking forward to tomorrow. And that's why we have to take all the precautions we have to do, like washing our hands, wearing our masks, to make sure, or to try to get to that tomorrow.
Thank you, Sandra. Nora, can I put you on the spot? One of our least appreciated populations is our school faculties and our teachers.
Yes.
And they're dealing with trauma in their own lives and pressure from all the parents. What are we doing to support them, or what do we need to do?
Good question. And everybody needs to take a deep breath every day. Our teachers are first line, front line, and definitely first responders. We all acknowledge that now. What are we doing to help them? We have special SEL programs for our employees. We have EAP. We have numbers that they could call anonymously. Of course, we bargain certain issues through the BTU. I also know that individual schools have really got out of the way to make kind of quiet rooms and de-stressing rooms, and really reaching out to our employees, not just teachers, all of our employees, to be able to speak openly that they need 10 minutes, they need a 15-minute break. And it's okay to do that, because trauma it's not an isolation, like you all said. It's cumulative, and it just keeps spiraling at times, and it's okay to say that you're not able to do something at that moment. So our administrators are working with our teachers and our staff. Certainly our superintendent and our school board have put as much resources as we possibly can to help them and to afford them to have flexible schedules as much as we possibly can. But they're near and dear to my heart, and I pray for them every day because it's tough.
Thank you. Well, I have you on the microphone. Question came in about being involved with their students. We know that for primary grades, for the elementary kids, parents are all over their projects, got sticky glue on their hands all the time, hear from the teachers. When the kids get towards middle school, the kids pull away a little bit, and the parents start to pull away a little bit. And then high school, they're like, they don't want to know us anymore.
Right.
But we still need to be involved in their curriculum. How do parents, without aggravating their kids to the point of closure, stay involved? How do they find out what's going on?
Well, I would certainly have a very close relationship with their teacher, either their online teacher or their in-person teacher. Really get on the school website and make sure what's available for their child, what the schedules are that way. But I'm a big proponent of dinners together, whatever that may look like. It could be a picnic outside by your pool. It could just be the two of you watching, the pets running past. But that one connection is just to get them to feel more comfortable to be able to share stuff with you. And for me, I tell them that they have to be unplugged for that time as well, because I know for me as an adult, I'm more stressed when I'm constantly checking my phone or online or watching CNN. So sometimes you have to give yourself permission to turn it all off. And that's one of the best things I can say to do with your kids. Unplug everything and listen. Don't judge, listen. That's the best advice I can give.
Thank you. Shantae, did you want to add something, or were you?
Yeah, along with what Nora just said, I think particularly when our kids are older, we want to give them an opportunity to have some choices. So whereas many of our adolescents aren't going to run home and tell the parent what grade they got on the test that particular day, but I think it's important for parents to say, as your parent, it's my job to know what's happening in school. It's my job to communicate with your teachers. So there are a couple of ways I could do that. I can have a conversation with this teacher. I can call the school counselor, or you and I can set a meeting every Wednesday or right after dinner, as Nora said. So involve them as much as appropriate in that decision making. So it's not something you're doing to them or you're forcing them to do, but see if you can engage them and come up with something like a family plan together.
Thank you. I like to suggest to parents when I'm doing training to parents not to say or not to choose to say, how was your day? Because once the kid says, okay, then it closes the conversation. But I always like to say to kids, what did you learn today? And then the kid says to you, nothing. And then you say, I sent you to school. You wore those Jordans that we paid for. You're telling me you didn't learn anything? What classes did you have? You engage a conversation. And kids want to talk, but sometimes you have to drag it out of them a little bit. So that's just one of the little tips that I use when I train. Sigourney, we were talking about trauma earlier, or we're consistently talking about trauma, but I wanted to get back to you because the question came up about the level of trauma that our LGBTQ youth population particularly is experiencing, and what are you seeing these days?
Well, that trauma has definitely doubled, and it's mostly because of the fact that they're in home. I will say this, that being in schools, I know kids fuss and fight about going, like, I don't want to go, I don't learn anything, but it's honestly a safe haven for them because that's where they get to be around their friends, they get to interact with people, they get to learn new things, they get to grow. And sometimes in the home, they can't always do that. So currently what I'm seeing a lot is that the youth are really being stifled. Some of them live in unsupportive homes, so they're hearing things that are very negative. For example, one young person I have, the word I'm not going to say the word, but the very derogatory term for a lesbian is being thrown around the house, and this young person is a lesbian. Like, they're hearing it constantly as opposed to having that reprieve. So that's causing additional trauma on top of the fact that they just can't be out at home. So they're hiding themselves. They can't go to their GSA meetings, which they used to just say, you know, is my after school appointment, or even go to places like SunServe, where we had our drop-in center groups that, like, we talk about all things LGBT related. They can't go to those and say, oh, I'm just going to the group at the church. That's where I'm going. So there's definitely a disconnect with youth being able to express their LGBT identity, and it's causing additional trauma for them if they even think about it, if they are in an unsupportive home.
So essentially, with the challenges of identifying your own identity and then dealing with it, accepting it, and sharing it, now is manifested or accelerated or magnified in an environment where you're not with people that are being supportive at all.
Yes.
Or less than fully supportive. So that leads to a question for both Blake and Sigourney. We have a question that came in that said, what are ways in which addictions professionals adapt to intersections of race, gender, and sexual identity? So it may be a little bit of an unclear question, but when you have this multiplicity of this identity issue, who's also self-medicating or dealing with their trauma by less than healthy behaviors, how do we find help for people like that, for young people like that?
Like, do you want to go first?
I was just going to ask you that.
Oh. We're so considerate of each other. I love it. I'll speak really quickly. I feel like you can definitely talk on the substance abuse piece, so I'm going to kick it right back to you.
Sure.
What we've been doing at SunServe for youth who they're experiencing, of course, substance abuse issues is just, of course, meeting them where they're at, trying not to create additional stigma. If it's, okay, you are vaping. All right, what's going on behind that? Like, what causes you to vape? If it's stress because of your relationship with your parent, all right, so now we know where the core issue is coming from. You're using that to actually kind of self-medicate. Let's work with that. Harm reduction is the main thing overall, as well as just getting them to talk about it and to not see it as like, okay, this is the only thing that I can do. So I'm going to kick it right back to Blake because I think he can expand on it better.
Honestly, that was a great answer. And that really is almost exactly what I was going to say. So it really is about, despite the cultural differences, of course, we have to always take those into consideration. And I always think about taking that into consideration when we're talking about the family system and when we're trying to treat the family system, because as we all know, it's a family disease when we're talking about substance use disorders. So I personally like the whole family to be involved in that process. So taking in different cultural backgrounds, religious backgrounds, all of that is very important to consider. But in the end, it really is about meeting the person, just like Sigourney said, meet them where they're at and listen to them and not try to impose our beliefs or our philosophies, our culture on another person. There is this old school mentality of what recovery is supposed to look like. And the reality is it's beautifully broadened over the last decade or so, where recovery can look like a lot of different things. And the definition I always like to talk about recovery is that, are you no longer using maladaptive coping mechanisms like substances? Are you happy with your life, or are you going towards being happy? And are you making progress in your life? And to me, that's recovery. That's in the simplest form, that's recovery. So regardless of background, belief, anything, it's about how do we help this person get away from the substances, focus on those underlying issues, work on them, and then start moving forward and making progress in their life.
Thank you. Thank you both very much. Keith, not in your current position, but in your long history, you have an incredible wealth of experience with people in the youth and the dependency system. Coming back to Broward County, we certainly have a population of young people in the dependency system, both in our schools, in our culture, but also aging out. In the time you've been back, what do we look like to you, and what do we need to look like?
Yeah, Joel, having had the, I guess, the unfortunate opportunity to be responsible for 14,000 children in the foster care system that I ran in Georgia, that spanned from newborns to those individuals who are aging out or transitioning from 18 through 24. That population has always faced some significant challenges of reaching other phases of their life. I'm talking about that transition population. Here in Broward, the things that I'm seeing and coming back is that we still need to have some intentionality around supports for individuals transitioning from foster care. That group that I historically have called nomads. I mean, that's the group that oftentimes will be couch surfing, will have some of the most horrific outcomes in the area of employment, in the area of education, and needing lots of supports. And transition that does not happen at age 17. Transition happens on the first day in which a child comes into care. That should be the focus. So I think that it still requires some collaborative efforts where we as adults have to understand a lot around brain development and the fact that young people still are growing their brains even in their transitional periods. Understanding that just because I register at age 18 does not mean that I am now ready to take on the world and that I need some supports. Even if you just look at those families who have lots of supports. Still now the average age of people leaving home now is 24, 25. And that's families with supports. And so what do we think the challenges will be for these individuals who have limited connections? So the thing that I would say that we need to do is to look at our whole continuum and see what kinds of supports that we have, because other than that, those individuals will find themselves in the homeless shelters. They will find themselves being in a traumatic experience to where they are using other substance in order to cope. They find themselves being underemployed. And so I think it's going to require some intentional efforts and some intentional supports. And whether that is the agencies that are currently doing that work, take a look at what their outcomes are and what they have been. And then also what I think is extremely important is talking to the young people. That group of young people will be able to tell you what it is that works for them, what it is that they need. That may be unconventional, it may sound preposterous or whatever, but why not try? Why not make that effort?
Thank you, Keith. Thank you very much. That's, again, Keith is an expert in that population, but coming back to Broward County, that's not in his direct wheelhouse, although certainly those kids end up accessing services. But so thank you for your more global vision on that. Nora, can I get you to come back?
I'm here.
Thank you. You have shepherded the district as one of the leaders with your peers through some significant tragedies over the last few years. Obviously, Marjory Stoneman Douglas is something that doesn't go away and will impact us all for a long time. And then we lost some young people in Deerfield Beach. And recently, the population may not know this, but we lost a young person in Coral Springs. And we've lost some staff too. You and your peers created a new department to deal with that, your recovery department. You want to share a little bit about what they bring to Broward County? Because I think that will be important for all of our folks to know how to access some of those services.
I actually think Shantae would be the person to talk about this. Shantae, do you know the details for this?
And I think Joel, give me a little bit of,
Phil Harris.
had a bit of a
Phil-
connection.
Phil Harris's department in the Center for Mind Body Wellness. See, folks, we didn't rehearse this. So I was trying to get us to take a look at
what he's doing
to social and emotional learning, not as an ancillary, but as an intensive piece of how we support our kids as they go through their school day.
I can say, I don't know, am I unmuted still? Yes. I can say that the superintendent has certainly, has been frontline for this, as well as the school board members. But Mr. Runcie has also started meditating and trying to have our teachers, our employees, our staff, and most importantly, our students in our community to start off and increase their mindfulness and to have that as part of their day, just like you said, not an add-in, but this is part of my life, and this is something that's going to help me from this point onward, because I need to be able to center myself and fully be in the moment. And I know that we have classes, we have various other options for them, but I really want to say that most teachers I talk to, that's how they start their day with their students. That is it. It sets their mind, it quiets it. And that's what I really wanted to say. However, more information could be at www.browardschools.com/recovery. And on that, you'll be able to see all the wonderful programs that we have going there. And Shantae, if you want to delete in or not, I'm okay.
No, that's totally okay. Sorry, I had a little bit of a glitch going. I do want to say that Dr. Harris did put the recovery services, the link to the website in the chat. I think one of the things that we are doing on the SEDNET side is really seeing how we can support schools. Now, what's interesting, or what we've had to adjust to like everyone else, is how do we deliver that support virtually? And how do we help teachers? So what we're doing we have suicide prevention specialists, but it's not just about the direct work in suicide. It really is about resilience and really promoting those positive coping skills. So what we do is schools can make a request, and we have one of our suicide prevention specialists work with the school and see how can we get presentations to teachers? How can we get presentations to students? But it's something you have to be very careful about in the virtual space. So we really turn that into keeping positivity, positive problem skills, increasing their coping skills to be able to handle the stress and anxiety that we've been talking about this evening. And so really we focus on promoting the children's resiliency.
Great lead in, and suicide is something that we've had a number of questions, or at least lead-ins, but leading up to that, let's start with where suicide spirals from. Sandra, depression. What is it? What do you think we're getting? People are asking for a definition of it. They're asking what the impact of it is. You're muted, my dear.
Okay, I'm sorry. As we all know, depression is one of those diagnoses that we do not put enough emphasis on, and we know how detrimental it can be to our community. So depression hurts, and depression is real. I just want to start by saying that. And we use the term lightly at times because we do not really consider the symptoms and the behaviors that come with depression. And suicide is not really my area, as you know, Joel, but I do know that depression leads to a lot of suicide. We know that older males commit more or die by suicide more often than any other population. We know that females attempt suicide more than any other population. So, and we look back as to why this happens. We talk about aging. We talk about females who have families or are the head of families, especially in the African-American population. They are the leaders of the families. They are the providers. And sometimes I see my families come into my organization and they have nowhere to turn and they have no resources and they don't know that our community agencies exist. So what we try to do is to direct them to the right sources. We try to educate them on the diagnosis, not only on depression, but other diagnoses. We try to educate them on the community resources. And we hope, and all our services are free to the community, by the way. They're all free. So we have classes and we have training and we educate and we talk about what depression looks like, and we talk about the number of individuals who are, going through depression, attempting suicide, and how many people are dying.
Thank you. Any other board members, panelists want to chime in about, not suicide yet, but the issue of depression? As you know, I will. Blake, anything with depression and substance dependence?
Yeah, thank you, Joel. The biggest thing that I would see is honestly, when somebody's struggling with a dependence or substance use disorder, it's the feelings of hopelessness that they have and the inability to escape their substance use disorder. And typically that comes from a place of stigma, of being too afraid to ask for help, to present it to their family, being too embarrassed to admit that they have an issue, so they don't see any other way out. And that's a scary place to be if you really think about it, that somebody is so desperate for help, but so afraid to ask that they're willing to end their own life instead of asking for help. And that's why town halls like this and conversations that we're having about mental health and substance abuse are so important. And not to use the word, but really to normalize substance use disorders, or at least getting help for them, as well as other mental health issues, is only going to come from having conversations like this. And that truly, though, where we see people get to the point where they have to end their own life is almost always based in feelings of hopelessness, like there is no other option for them.
And if I may just add, I just want to add that, it's important for us to understand that depression is treatable. It's one of those diagnoses that is really treatable. And a number of people will say, do we only need to take medication to help with our depression? But there are other modalities that we can approach. We can do talk therapy. We can do electrical, other areas that we can really look into. So it's important that we tell individuals that it's not a death sentence, it's treatable, and many individuals can move on to living a normal life, going back to work, going back to school, enjoying life, and just being a productive citizen.
Thank you. So, Borny, any comment about depression in the population you work with?
I have sounds more than I have words on that, and
threw you a softball, huh?
It was easiest question to answer, I promise. Honestly, because of all of the intersections that happen when you're an LGBT individual, just depression on top of that. And I'm speaking as someone who is LGBT, is African American, also kind of Caribbean American on my mom's side. Dealing with mental health in those communities, it doesn't really happen. In the LGBT community, it's understood a little bit more and it's more accepted. But then it's like, okay, so this is just one aspect of your identity, your sexual orientation, your gender identity. You learn these things as you get older. You're learning more about yourself. So it's more so like, what are you hearing? What are you growing up with? Where when you're having these conversations, it's more difficult. So we have folks who they come into our services and they don't want the services, but you can see that this person is hurting, that they're going through something. and it's kind of breaking through that barrier. And then once you break through it, everything comes out. And it's just, it's difficult. That's all I can say. And thank you for the softball question.
Well, so let me be a little less softball, and you can absolutely whip on it if you like.
Okay.
But being a Caribbean, Black, LGBTQ young person, younger than me anyway, how did you get through it to be this beautiful person, to be this whole person?
I am still going through it. I very much, and I hope this is not too much of a share, and if I do overshare, let me know. I very much admit that it took me years for myself to begin therapy. I've only been in therapy for a year and a half, maybe, but I've known for years that I needed it, and I'm a huge proponent for bettering yourself in every single way, especially mental health. And I fight to destigmatize it. And I encourage individuals to learn about it, to go to like a singular session. And if maybe that's not it, read about it, learn about it. Don't feel as if you can't get help, that because in your community and things that I've heard, of course, oh, therapy, that's a white people thing. Oh, therapy, we can't afford that. It's possible. You can afford it. There's free services out there. You just have to look. As a youth, it's definitely harder, but that's where that piece of go to a parent, go to any older adult who could help you, especially at your schools. And I feel like I'm on my soapbox. I'm gonna get off a little bit, but for myself, I fought that stigma for years. And it wasn't until, like I mentioned recently, I got past that stigma, and it was one of the scariest things that I ever did, but it was probably one of the most fulfilling things. I love my therapist. I get a lot out, and I feel like I am even better than I was a couple of years ago. So it's a constant thing.
You definitely didn't pass on it. I think that was a run, and I thank you for your honesty and willingness to share. That was pretty beautiful.
Can
So
I say something, Joel?
Go ahead, Nora. Go ahead, Nora.
When it comes to what counseling or how you handle your depression, it looks different for every person, and you have to be able to reach out. For me, I went to a horse therapy place, and that helped me tremendously during Marjorie Stoneman Douglas, because everybody around you, everything that you did, every part of your day was just so heavy. And I noticed that I wasn't kind of bouncing back. So I do want to give a nod to my friend Abby Mosher for her wonderful Tomorrow's Rainbow, but there's also other wonderful organizations as well, because sometimes you may think sitting in a doctor's office is not for you, but there's various other ways for you to be able to get the help that you need and feel comfortable in doing so. And tell anybody, because I was afraid to talk to anybody, even my own family. So that's something that's on me, because they're the most wonderful family, and I know that I should have reached out, but I didn't. So whenever I have the opportunity to share personally, which is now being recorded, that's pretty out for an elected official. And I want you all to know that it does get better, and you can get better if you just open up and talk to someone. Trust us. That's all I got.
And I think that for everyone that's listening, you're getting raw and real information, and I hope that that's resonating with you. None of us are perfect people. None of us are 100% healthy or 100% unhealthy. I want to go back to the question about depression and make just a few comments, and then maybe some of the panelists would want to jump back in. Depression, the first most commonly diagnosed illness in America and in the world is anxiety. The second most diagnosed illness is depression. And depression can be diagnosed in about 1 in 15 people. So typically, if we were all together, I'd ask you to look to the left and look to the right and pick the ones out that are depressed. And depression is not coming home from a Dolphins loss and feeling down in the dumps, although we don't have to worry about that right now. To be clinically depressed, you must be essentially dysfunctional for a minimum of 2 weeks. And by dysfunctional, you're talking about going from the bed to the couch, and that's about it. You're talking about having the regular, normal routines of your life totally disrupted and not able to carry them out, not taking a shower or a bath, things like that. So we want to be careful not to self-diagnose in meetings like this, but to encourage you that if you have concerns, there are some clear signs. You can certainly reach out to me, you can reach out to Sandra, everyone on this panel can provide you with the right resources. But as Sandra said, the debilitating thing is that these illnesses are so common. The great thing is that they are really, really treatable. And the treatment has multiple prongs. One of the prongs is medication. The great thing about medication is that the right medication works. The bad thing is it's not easy to find the right medication. And sometimes the side effects, the weight gain, the weight loss, the confusion, the interruption of sleep can be very upsetting. But finding the right medication, and by the way, every one of us on the panel could be taking the same medication with totally different effects because it's all our own genes, it's all our own DNA. The second thing is therapy. And what Saborni said was very beautiful about how she loved her therapist. But so often what happens is a person will call me and say, I went to such and such agency and that therapy didn't do me any good. Well, it was partially the relationship between you and the therapist, the lack of connection. So it's important to find the right therapist and not to give up if the first part of a relationship doesn't work. And the third thing, without being on a soapbox about this whole issue, is staying the course. Because when you start, and I see my peers, my partners are nodding their head, because if you start with a medication and you don't like the impact of it, you just say, I don't need the therapy, or I'm not going to do it. Or if you have a relationship with a therapist that doesn't resonate the first time, and so you don't do it. So the medication might be working, but the therapeutic supports might not be. That doesn't mean the process won't work. We have to give it time. And then the flip side of that is when you start to feel better, your brain chemistry has already changed. And so if you stop doing what you did to be better, the chances are you're not going to stay better. Blake, maybe you want to piggyback on that in the world of recovery. Does that make sense?
I mean, I think you really said it all right there. I mean, you're absolutely right. Everything that you said is just so relatable to everything to do with substance use disorders and recovery. And I mean, that's the beauty of it right there. It's substance use disorder is a mental health disorder, and we really do treat them the same, and they take time, and there's no quick fix, and it's trial and error. And again, like I said earlier, family involvement, making sure the family's educated and everybody's educated on the process and informed prior to starting the process that this avenue may not work or this avenue may not work, but we need to be consistent with it. I mean, if we look at a substance use disorder as a habit, as part of it is in the brain chemistry, then we know it's going to take time and consistency to get better. And exactly what you're saying, it just, everything that's been said, honestly, there's been so many good things that have been said that I want to just turn my mute button off and like jump in and just agree. But you guys have all been so amazing tonight.
So we're starting to wind down. I think we covered a number of the questions. There were some specific questions about how to handle a 14-year-old and so on and so forth, which we're not going to get to everything, but I want to promise you that if you pose the questions to Laura and to the PTA. She will filter them out to any of all of us to try and reach out to you. Also, Bert and Laura, kudos, phenomenal job. And I know it's no secret that you plan for there to be a number of these, one in each of our school board members' districts, and then maybe one for the special needs population specifically to get their questions answered. I want to encourage everybody to stay on as we begin to close so that Bert can facilitate the raffle. But I want to give all of our panelists an opportunity, a couple of minutes, to share what's going on in their world, anything we left out, any question I wasn't smart enough to ask, and to try and share information with everybody so that we bring this kind of to a wrap for everybody. Keith, you're the best dressed, so let's start with you.
Yeah, well, just once again, thanks for the opportunity. Joe, when I look back over this discussion, the things that just jump out at me that I just want to relay to the group is about support. Find your support systems. Find where you are being fed, where you are being lifted up, whether that's family, friend, therapist, a colleague, etc. We all need to have some sense and some level of support. When we talk about stress and we talk about trauma, one of the major differences that I see over this lifetime has been that our children, and then now their parents and adults, are experiencing more life-ending stressors than life-threatening stressors. There was a time when we only faced really life-threatening stressors, but today you can walk out and we're facing life-ending stressors. And so it's as a result of those stressors about our ability to recover from stress. And so if we are not having life-threatening stresses, but we're always in a state of life-ending stresses, it makes it extremely difficult to recover. And so I would encourage everybody to create and to develop and to sustain those support systems. And then from a Broward County system-wide effort, I think that partnership is going to be key. And we can't do this work alone. We need each and every one of you, and each and every one of you are valuable. So thank you for the opportunity.
Thank you, Keith. Sandra?
I think he took a lot of what I was going to say, so I'm going to be very brief. First, again, thank you all for having me. Bringing awareness to mental illness is what we need to do every day, all the time, because through education and support is, basically the only way we can get through this. Mental illness isn't going anywhere. In fact, we've seen the prevalence of diagnosis and our DSM-5 has way more diagnoses than ever before, and they're only building. But to do this, we need the support of the community. And one of the things that has really held Broward County together is the fact that the mental health community have worked together. We have collaborated over the years to bring awareness to mental health and to uphold each other. So as we continue to do this, and I'm really grateful to all the agencies in the room, as we continue to provide support and education to the mental health community, I also stress that we include advocacy in our day-to-day. We have to continue to advocate for more services. And if we get bond together and we continue to ask and we continue to have all our elected officials on board, we can do better than being the 49th state in terms of the amount of funding we get for mental health. And we will continue to do this as a community because we see the need, we have the population, and our aim is to give people the dignity and respect that they need, regardless of the fact that they're living with a mental illness. So again, I thank you so much for having me.
Thank you, Sandra. And while Sandra's talking on both a community and a global level, it's important for everyone to have 211 first call for help on your phone, near your phone. That should be the one door that gets you to the help that you need. You can reach out to any of us, agencies, people, whatever, but they are committed to do that work you saw their little blurb at the beginning, and that should, if you don't remember anybody's name, but you remember 211, you'll be at least the first step down the road. Shantae, anything you'd like to add to this evening?
Sure. I just want to say we've touched on so many things. We could be here for hours, but a couple of the things I want to leave everyone with, because ultimately parents and families want to know, how do I know how big of a problem this is for my child? And so one of the ways you can do that is, how is this affecting your child's ability to live, laugh, love, and especially learn, right? And so if it's interfering with their ability to do either of those things, that's a signal that it's time to reach out for help, and help is here. Another one of the things I want to say for everyone on the panel, which was great, is our charge is to help educate so that we reduce that stigma, so that we give people a safe space to articulate what it is that they're going through. Absolutely, Joel. Take a look at Joel's shirt. And so that's our work, and that's our advocacy that Sandra was talking about making it okay for us to have these conversations. So kudos to the PTSA for organizing this event, and I hope this is something that we can continue to see.
Thank you. I want to take just a brief detour to my partner. Allie, did I leave anything out, or is there anything that we need to address?
You know, I would really love it if you touched on for a moment with the Hope Clubs. We had several questions about how we can get this information specifically to the youth, to the high school students and the middle school students that could use this. And I know that a majority of our high schools have those clubs, but could you just spend a moment telling the viewers about that and how they could access it?
Sure. And without taking too much time, my organization for the last almost 10 years has supported the Hope Sunshine Clubs in schools. These are leadership clubs which are based on social and emotional learning environments. They're led there is a sponsor, but they're led by the kids, and we have a full curriculum of opportunities for them. They are challenged this year, like everything is challenged. We are not the only positive club. The wellness group that Dr. Harris is supporting has the ambassadors. So I don't want to only take credit for those kinds of things, but yes, we do. And anyone who's interested to find out if they have one functioning at your school, please just text me, or you'll get my name in this, and I will follow through directly. Thank you, Allie. Bernie, can we go to you? I caught you.
You caught me. No, I got distracted by something in the chat that someone put about their sibling expressing suicidal ideations and being told that the therapist forgot about the session. Personal thing. So, but
that was directed to you, or do you need help?
No, it's to everyone. It's just a statement in the chat. So I'm just saying, like,
Allie, if you capture that person, we can try and respond to that directly.
Already did.
Okay, thanks.
Allie is on it, but yeah, I just want to speak on something really, really quickly, and that is that with being LGBT, just know that's not the cause for mental illness. There does seem to be, and that idea that still floats around, that if you're LGBT, you have some form of illness going on, and people are sometimes at our agency thrown right into therapy, and it's no, this is a very well-functioning child. They're doing great in school. They just came out to you last week, and like, maybe you're the one who's kind of freaking out. So yes, we're here talking about youth, but also like families. It is no problem trying to do family therapy as well as individual therapy for the adults, because the thing is that when you're coming out, you've had time to process a lot of it. It's the family who, the minute you say something, they're like, wait, I have to change everything around. So that's just one thing. But also, SunServe is the quote, and I'm just going to put the quotes around it, the only LGBTQ youth agency, or the agency that has a LGBTQ youth component in the entire county. So I will admit that it may be a time where if anybody contacts us, there's a wait list for getting in to see one of our therapists or our life coaches, but please understand that we will never leave anyone hanging. We understand that there's that need, there's that help, and we have amazing partners that we work with. And I just want to throw out there, like, hey, you literally call, we help, if you text me, if you call me, if you email me, it's better because I always respond to my emails. You will always find help at SunServe, especially for a young person who needs it. So please reach out.
So if you're a family member, can a youth bring a mom and a dad or a grandma for understanding help as well to SunServe?
Yes, if it's not just for service, it's like, hey, I just need to have someone kind of help to facilitate that conversation. That's not our forte, but at the same time, it is. Like, we don't get, it's like you don't get paid for it, but our slogan, our motto is literally, we help people. And if it's that maybe you prefer a therapist over someone who they just have their BSW, although it is an awesome school, just saying. Like, I will sit through it with you. I will try to help process as much as possible. I will still, of course, point out I am not a licensed therapist, but I am someone who can listen. I do have a life coaching certification. I have done this in the past. So all you have to do is really ask for the help. And if, hey, you get past me and you're like, I need more resources, that is something that we do, connections to resources.
Great, thank you.
You're welcome.
Blake?
Sure, yeah, so I just want to echo everyone's gratitude for being here, and thank you for having me, and thank you to the other panelists for all of your awesome information and all of the different resources that were offered tonight. I've learned a lot, honestly. I learned about a ton of new resources. The only other thing that I would add that I didn't get a chance to say was that Alcoholics Anonymous has a saying called contempt prior to investigation. And what that means is disliking something or hating something before you understand it. And that is a big no-no. And I'm grateful for the 90 or so or 100 or so people who are here tonight that are willing to learn. But the fact is, a lot of people aren't, and a lot of people judge before they educate themselves. So all of us here, everyone in this room, should be an advocate for those who struggle. Everyone, you don't have to have a specific license or certification or anything to be an advocate. All it takes is talking about our issues, talking about ourselves on a vulnerable level, and discussing with those around us what we've struggled with, what we're struggling with, and how we got out of it. And that's enough to help somebody else. So that would be the one piece that I would add, is just take time to educate yourself on the different mental illnesses that exist. Take time to educate yourself on substance use disorders, and do your best to throw away those old stigmas, those old stereotypes that people have of what an addict or an alcoholic is supposed to be. In fact, throw away those words. I would really love if people stopped using them and start using words like substance use disorders, or a person who's struggling with a substance use problem, because then we can really look at it as if it's a problem that can be treated, as instead of a label that puts somebody into a box. But other than that, thank you for having me. Wear a mask, wash your hands, everybody.
And last but not least, before we turn it back over to Bert, Nora.
Oh, thank you. I just wanted to thank my fellow panelists. You guys did an awesome, awesome job. And also to thank Bert and Laura, and to have such the ability to put this together. My hands are up in the air for you guys, because you really did a great job. And I just want to say that a year ago, when we had those 3 deaths in Deerfield Beach, it was, nobody came to me, pucked me on the shoulder. I just called everybody I knew and said, we need to do something. We need to do something now. And we held a town hall for mental health in Pompano Beach at Pat Larkin's. And we had several hundred people in person show up. And Bert was there and came to the event and said, you know what? When I become the new president of the Broward County, I always say it wrong, Council of PTSA, he's going to bring it to each board member's district and get the word out. And I think that is so remarkable. Having this tonight as a starting point, we are going to break through that stigma, and we're going to change lives. So thank you all for everything you do. Thanks.
Thank you. So I think clearly the panelists were magnificent. and were full of integrity and honesty and tried to address every question. But more than that, thank you to our audience who took the time out on a Thursday night because they are concerned, because they are interested. I hope we did a good job addressing as many of your questions as we possibly could. I'm certainly honored to be a part of it, and I thank you. And please, we will send out our contact information. We are not running away, we are running to, so that we are here to be supportive and to help find solutions. And with that, I thank you and turn it back over to our president, Bert Miller.
Thank you, Joel. I first want to say thank you to all the panelists. I mean, Saborni, Keith, Shantae, Sandra, Blake, Nora, and Joel. You guys did an awesome job. This really was what I was expecting and hoping to happen. I'm just sad that we are in the pandemic that we're in, and it's got to be virtual. I was hoping it to be in person, but we do have another one. I think the next one is going to be scheduled in March, hopefully in District 5. But we are planning to have one in every district over the next 2 years. So we're going to do 3 this year and 4 next year. So thank you all. We really appreciate everybody that attended. I hope you guys got a wealth of knowledge tonight and leave here empowered. So I would like to, let me see, I'm going to share something right now. Let's see. We want to share our resource fair providers, which we are going to email to everybody. We will send out any information that we have on them via email. That was one of the reasons why we captured your emails when you guys registered.
I have one question.
Go ahead. Somebody got a question?
I hear we're here for some baggage something.
Yes, you will. They're going to be while supplies last. I'm not sure how many they have and how many people requested them, but will be delivering some goodie bags with some stuff from some of these vendors over the next, I think, 5 days.
So how do we get one?
Did you request one when you registered?
Oh, so we're supposed to give a zip code and that kind of thing? Oh, could I re-register?
You registered when you came in, right?
Yeah, but could I re-register?
What's your last name? And I'll look it up.
What?
What's your last name?
Ayeba?
Okay. So let's see, we're going to do we've got some giveaways here to give away. And I was busy while the event was going on, writing down everybody's names. And I wrote down there was 113 people in there. So I've got a bunch of everybody's names in here. We're going to give away this basket from Fund Services. Fund Services is a company that helps all of our schools fundraise, use holiday shops and stuff. So we're going to give away the basket first. And the person that gets the basket is Linda Justiling. Is she still here? Let's see.
Some people left.
Oh, she's still here. She's still showing that she's here. Linda, are you here? Linda, unmute yourself if you're here. Okay. Linda, going once, going twice. Okay, I'm going to pull another one for the basket.
Please be my name.
Okay, let's see. We've got Luz Angela Venturas. Let's see if they're still here. Nope, they're gone. Let's pull another one. Lorraine, not Lawrence.
I'm here.
You're here? Okay.
Yep.
The basket. Okay, you get the basket.
Yes, I want a basket.
Now we've got some gift cards. We got a Target gift card, $5.
Linda has her hand up. She may not know how to unmute herself, or she might be on a phone. But I just saw her hand come up in the participants box. Maybe she can get the next one or something.
Okay. All right, then we'll give her the gift card. Okay, we'll give her the Target gift card then.
I just know that a lot of parents, it may be a grandparent, technology is not easy to navigate.
If you can unmute themselves or something though. Okay, we got the Panera Bread, a $25 gift card for Panera Bread. Beth San Marino. They say they're still here.
Betsabet provided a lot of feedback in the chat box. So say hi, Betsabet. Can you unmute yourself and say hi? She said she's trying in the chat box.
Okay, so she's here?
Yeah, I'm talking to her right now.
Okay, so she gets the Panera Bread.
She had a lot of really great questions. Thank you for providing to us. She's very happy, going yay.
Okay, she gets the Panera Bread. Now we have, let's see, we have 2 gift cards. We're going to give one away for Domino's for $15 each. Lyndon Joseph.
Thank you. I finally.
Yes, I'm here.
You here? Okay.
Yes.
You get a $15 gift card for Domino's.
Okay.
Oh, this is Betsabet. I finally unmuted. Thank you.
Okay. Now we got our last one is another gift card for Domino's. Joseph Balchunas. He's not here. He left. He's not in. All right, let's pull another one. Maria Saenz. She says she's here. S-A-E-N-Z. Maria Saenz. Can you unmute yourself?
They just put something on the chat.
Yeah, she's in the chat. She said she's here.
Yeah,
Thank you.
Okay.
Yes, guys, thank you so much.
Okay, you get a Domino's card.
Woohoo!
Is my name in there?
So, okay, so let me read these again. We have Linda Justin, it's got a Target card. We've got Lorraine, not Lawrence, it's got the basket. We've got Beth Zamorano, Panera Bread gift card. Maria Sainz, Domino's card. And Lyndon Joseph, a Domino's card. So that concludes our event. I would really like to thank everyone again for attending. Please watch for our next ones, which will be in March, our next one coming up. A lot of work goes into these. I want to thank Laura for, I know how many hours she's put into this and how nervous she was all day, that this was going to go smooth and people were going to show up. I want to thank Nora for your efforts, and Joel and the rest of the committee, and Wendy and everybody else, Lisa. Thank you guys so much. Lisa, Matthew, you've been just phenomenal with helping out. I really do appreciate all your help that you guys have done. And I do see right here on my screen that we have one of the newly elected school board members, Debbie Hickson, with us as well. Hi, Debbie. Thanks for joining us. I appreciate it. I know Sarah was on earlier and then she had to get off. But thank you all. We really do appreciate it. If you want any information, a lot of information is going to be posted on our website at browardptsa.org. We've got a mental health page there that a lot of information, they're in the midst of loading it right now. So please go there for any information that you need. Nora, again, thank you so much. Without the support of the school board member in the district, it's really hard to get the audience and stuff that we have. We really do appreciate it, and your robocalls and stuff. So thank you. I appreciate it.
Can I shout out to 3 people, please?
Go ahead, Linda.
I would like to shout out to my PE teacher, Miss O'Connor, that she's in here, and my 2 friends, Tommy Nelson and Dominic. They're both in here. They're all in here.
Thank you, Lyndon.
Crystal Lake.
Thank you, guys. Debbie, would you like to say something quick?
Good evening. Can you hear me? I keep having trouble with my, okay, great. Thank you so much for hosting this. I put a little thing in the chat. I didn't want to jump into your thing here, but so very necessary. One of the things that I ran on was improving the mental health services that we offer our students in the district. And there are so many resources that are available for free, and they just don't know where to access them. So having something like this and giving them all that information at one time is really, really helpful. And so as a district-wide school board member, I look forward to seeing more of these and helping however I can. And thanks, Nora, for being part of it and telling me to hop on.
Thank you, Debbie. We appreciate it, and welcome to the family of the school board. Laura, do you want to say any closing remarks?
I think you really did a good job, wrapping it up, and we've thanked everybody. But we are going to do over the next 2 years. We're planning on, we've got 6 more that we will do. Our hope, of course, is that we'll be brick and mortar, so that we can really, that would just be the greatest thing, because I really would like to get with my committee, with all the people that have been putting this forward. And when we're in person, I'm very excited about what we had happen here tonight. But in person too gives it a whole nother element. But and thank you to those who shared anything that they're going through. It means a lot for people to realize that a lot of us are going through things and have sought help at some point in our life. So thank you for reaching out, and the panelists, thank you for being here. And know that we will be reaching out to some of our providers and some of the individuals on the call tonight for our next ones as well. So thank you guys so much, and have a good rest of the night. Stay safe, and thanks again.
Thank you, Laura. Just so you guys know, we did have registrants from around the state and including Georgia, that people were on here tonight. That when like Nora talked before about when she had it in Pompano and I visited that, I was asking people where they were from, and I was really blown away. They were all from around the county. And I think that we had every city in Broward here tonight with us. That were people that were on here. I don't think there was one city in Broward County that was not represented. So it just shows the need of how much that this county really needs mental health support. So thank you all, and hang in there. Hopefully we get through this pandemic together soon, and we can move forward and have in person in March. So thank you all. Good night, everybody.
Good night.
Good night. Good night. You're so late.
Good night, everyone.
Good night. Thank you.
Good night. Thank you.
Good night. Thank you so much.
Bye, guys.
Bye. You're the best.
Bye, guys.
Have a good night.
Thank you.
And
Have a wonderful day.
Happy to see some people that I vote for them.
Thank you guys again for having me. It means a lot. So thank you so much, guys.
You too.
Thanks for having me.
Good night, guys.
This is Allie. I want to reach out to you, okay?
We'll have you on the next one as well. It's
Oh,
great
that'd be
having you.
Oh no.
Be happy to participate however I can. And if there's any kids or any schools to talk to or anything like that, I'm happy to jump in that as well.
I'm a kid.
I know you are, Marcel. I'm so glad that you talked tonight.
Okay.
All right.
I'm an adult.
All right, Manuel, good.
All right. Bye, guys.
Bye.
Bye.
You know, it's good that we had some kids on here listening. That was good.